Welcome to the Psych and Business Podcast. We're here to show you how practical psychology can be useful and make your workplace better. I'm Dr. Ernest Wayde. So as a reminder, we've been going through the story with Blue Rivers Hospital. And a few weeks ago, you were introduced to Blue Rivers and Dr. Emily Carter, who is the new acting CEO. Dr. Carter is working to improve the conditions for her nurses with the eventual goal of increasing employee engagement and organizational profit. Through the behavioral chain analysis, Dr. Carter has identified some concrete steps she can take to help the nurses feel supported and valued, which should lead to a change in behavior. Dr. Carter has realized some of the changes need to go through the Optima Health System CEO, so she set up a meeting with that CEO as soon as possible. Let's get back to the story. A week later, Dr. Carter met with the CEO of Optima Health Systems, Diana Johnson. At this first meeting with Ms. Johnson, Dr. Carter was excited to share the work she had done to understand the nature of the Blue Rivers problems and her plans to solve them and make the organization profitable again. However, before Dr. Carter could get into her list of issues and requests, Dr. Carter was informed that Blue Rivers had to move over to the Optima Health System's electronic health record system in the next 6 months. This news caught Dr. Carter off guard, as Blue Rivers had recently, within the last 6 months in fact, invested in the new electronic health record system that they were still working to fully integrate and optimize utilization of that new system. Staff were still struggling to fully adopt the new system, but were just beginning to get the hang of that new system. Dr. Carter did not think it would be a good idea to replace that with a completely new system in the next 6 months. Additionally, as someone who still saw patients, Dr. Carter herself had not had an easy time learning and adapting to that new EHR into her own work. But having put in that significant effort, she did not appreciate having to have wasted that time and then have to learn a completely new system, now having to repeat that very laborious and sometimes frustrating process with a completely new electronic health record system. Dr. Carter felt frustrated and did not believe that this new change would be in the best interest of the Blue Rivers employees. Dr. Carter tried to make a case for keeping the current electronic health record system. She highlighted the growing proficiency of staff to the new EHR, highlighted the financial and time costs associated with implementing the current electronic health system. Despite her appeals for keeping the current EHR, though, Ms. Johnson stated that Optima Health Systems, as a matter of practice and process, had all their hospitals on the same system, as it improved coordination and facilitated referrals within the Optima Health System network, which was shown to lead to increased revenue for the system and the individual hospitals. Additionally, because of the large institutional knowledge of the Optima Health System's electronic health record, Optima Health System was able to offer support to help increase the speed of adoption and proficiency at Blue Rivers once they got on with the new electronic health record system. Finally, the economies of scale gained by having to maintain one system was significant. For these reasons, Blue Rivers would have to move over to the new electronic health record as planned. Dr. Carter was skeptical about how much help Optima Health Systems could provide, or how helpful that would actually be to her and her staff. All she could think about was how hard it had been to learn the current EHR and how frustrating the experience had been for herself. She knew this would not be well received by her staff. Dr. Carter was also smart enough to understand that along with this new organizational change, she still, as the leader, had to deal with the current financial losses, the staff turnover and absenteeism, the aftermath of the acquisition, and the public image of the hospital. Dr. Carter's challenges were also compounded by the need to balance her own career as a surgeon and a researcher, and now as a leader of the organization. She began to feel overwhelmed, anxious, and stressed at how much she had to do, and began to doubt that she was well suited to handle this job. Frankly, at this point, she wasn't even sure if she wanted the job. These feelings caused her to feel sad and angry about her work experience. People began to notice that after Dr. Carter's return from her meeting with Ms. Johnson at Optima Health System, she became contrary in meetings, defiant when dealing with Optima Health Systems, and moody with the Blue River staff. Okay, let's stop the story there. With all the changes going on in the world nowadays, especially after COVID, change is a constant that you can't get away from. A lot of organizations have just been going, trying to push through a lot of change in an effort to adapt to the new world order. But research shows that over half of those change initiatives fail. This has resulted in a condition called change saturation. In fact, over 70% of organizations are experiencing change saturation right now. This has a consequence on staff. It's common to see staff displaying saturation behaviors, including disengagement, apathy, frustration, increased stress, fatigue, burnout, more resistance to change, confusion, cynicism, and skepticism. If you're displaying these behaviors, it's important for you to know that you are not alone. Research shows that the average number of employees experienced 10 planned enterprise-level changes in 2022. 10 changes in the year. That's not even counting the unplanned ones, like, say, an acquisition or a new electronic health record system. This is clearly a widespread issue in many organizations. Are you experiencing change saturation? Even if you're the boss, the manager, or the employee, are you showing signs of these behaviors? As I said, you are not alone. If you've enjoyed this episode, please consider subscribing and leaving us a review. Feedback is a gift, and we love gifts. Thanks for listening. I hope you'll join us again next time.